Hey guys, welcome back to my channel. My name is Brittany, and today I wanted to create a video about home health nursing, the pros and cons if you are interested in working in the home health field. I did work as a home health nurse in the very beginning of my nursing career, so I wanted to give some pros and cons of how my experience was back when I used to do this. I do want to also say I'm finally at 1,000 subscribers. Thank you everybody who has subscribed to my channel and who watches my content and who has supported me so far in my journey of creating content on YouTube. So let's get right into the topic for today as far as talking about the pros and cons of working in home health nursing. So I did, just a little disclaimer, I worked in home health as a pediatric nurse in the pediatric field. So this is my experience based on that. So let's start with the pros. So the number one pro obviously is going to be that this is going to get you away from the bedside. Home health nursing is totally different from anything that you're going to experience in comparison to being an inpatient nurse. So I actually found out about home health nursing. I ended up applying for a job after I was actually laid off from my first job. And it was actually a really great experience. And so this is going to be the number one thing. It's going to get you out and away from the bedside if you are looking for something that is totally different in comparison to working inpatient. The second pro is going to be that you're going to be able to have one patient at a time. So I have two different experiences with working in home health or with a home health agency. The first experience that I had one patient at a time. So as far as meds, tasks, anything that was needed for the patient, it was only me and this other patient that was in the room together, and I didn't have to worry about having 4 other patients or a team of 10 or however many when it comes to the assignment, and they make the assignment for you. When you're in comparison to inpatient, you typically have one patient at a time. Now, I did have another experience where I worked in pretty much like a group home setting. So in this situation, it was actually a house that the agency owned, and let's say there were maybe 3 or 4 bedrooms that were in the home. Me and another nurse actually worked in this home with, let's say, 4 patients. So, or let's say 6, I think it was 6 actually. So she had 3 patients at a time and I had 3 patients at a time. So it just depends on the agency that you find, but typically in home health nursing, you're gonna have one patient at a time. So if you wanna find something where you can kind of cut back on having to have so many patients to take care of all at once, this is gonna be a really good option for you. The third pro is gonna be that there's gonna be very little micromanaging in comparison to inpatient. So inpatient, you know, you got your manager, assistant nurse manager, your charge nurse. There's so many people that are on the floor that have a hand in what you're doing, and so many opportunities for them to micromanage you. And while some people might not be bothered by that, sometimes that can be very stressful and a lot of pressure, because not only are you answering to your managers, but you can also be answering to the doctors, patients, and their family members. So if you're in a home health environment, it's going to give you the autonomy to be more independent, and you'll have less people to kind of answer to. Now, instead of having a nurse manager, what you'll end up having is a case manager. So the case manager will kind of know an overview over so many patients, and nurses will be assigned to certain patients, but the case manager is going to be the one that will manage everything and oversee and supervise and make sure everything gets done for the patient and that they have everything that they need. And so number 4 kind of ties into what I said. This will allow you to work independently. It'll be you and your patient, or their family members there as well. And you'll have that ability to be working by yourself and not have so many hands in the pot. So that could be a good or a bad thing depending on how you look at it. And then lastly, the last pro I wanted to mention is you'll have the ability to make your own schedule. Now, This depends on, in comparison to all different environments or different situations. There are nurses who work inpatient that do have the ability to make their own schedule. They put their request in, and their managers will either approve it or not approve it. And some people probably work in a place where they're able to actually, for the most part, get the days that they want off. But in home health, it's totally, I would say 99% of the time, you are really making your schedule. You have the ability to say yes to a patient, or say yes to taking an assignment, or saying no to taking an assignment. Unless you make a specific obligation to take care of a specific patient, certain days of the week, certain times. Sometimes they have 12-hour shifts, sometimes they have 8-hour shifts. Depends on the agency that you work with. But for the most part, you are totally in control of your schedule. And that's something that is, I would like, and things that I always look for when I look for jobs. So if you really want to have that ability to say, hey, I don't want to work this day, or I don't want to work this day, or I want to be more in control of what patients that I want to take and what patients I'm comfortable taking, then home health nursing is definitely going to be for you. Now, let's move on to the cons, because there are definitely some cons to think about, and there are definitely going to be some things that you're going to be giving up with leaving the hospital and going into a home health environment. So the number one con, y'all, is going to be the pay. And what I want to say about this is, across the board, for the most part, any nursing job that you take that is going to be maybe a little less stressful, or less responsibilities, or less duties, to be honest, you are going to take a pay cut. Now, I'll say this, in Texas, I feel like the home health nurses out here, they do make really good money in comparison to when I was in Florida. In Florida, and I have a whole nother story about pay when it comes to working as a nurse in Florida, but what I can make as a home health nurse here, you probably won't make that in Florida. So I'll just say that it always is going to depend on your location and where you are. So from my research and experience, when I was in Florida and versus here, as a home health nurse, you're just going to make less money. So that's just kind of what it is. And the next con is going to be that you might end up driving more and spending more money in gas. So for inpatient, or let's say if you have one location that you go to for work, you go to that one place, you have the amount of time that it's going to take you to get from your house to that location. With home health nursing, like I had said, sometimes, or a lot of times, they give you the opportunity to accept a client or to decline a client, or to say you're comfortable with taking care of a certain patient based on what's going on with them and their plan of care, or to say not, yes or no. So with that being said, sometimes you can end up in situations where you're kind of driving to several locations around the city instead of just going to one location if you work in the hospital. So that's definitely something to think about, because in the end, you have to take into account the fact that you're making less, and that you may be driving more, you might be driving far, unless you get a situation where you can find patients and clients that are in your neighborhood or around your location. But there's always a possibility that you might end up on the other side of town. So that's definitely something to think about if you want to make home health nursing your primary income. And the next con is going to be that you're working inside a client's or patient's home. So it's not like the hospital where you have all your supplies there. Or I'll say this, in the hospital, you have your supplies, you have your equipment, you have everything that's readily there available for you. When you are in home health nursing, and depending on the agency, when you get there, you're in someone else's private home. Sometimes that can be good, sometimes that can be bad. Sometimes it can make the nurse feel uncomfortable, and sometimes it can make the nurse feel very comfortable, especially if they have a good relationship with the clients or the patient's family. With their parents, if it's in peds, and if you're not comfortable, then it's just going to be a long shift. I'm just say that it's going to be a really long shift, and you're probably not going to be wanting to go back to that patient's home, and you're going to be trying to look for another assignment. So that's definitely something to think about. Are you comfortable going into another person's home to take care of the patient? So just something to think about. And another con that I found is and this could have changed because it's been a couple of years since I've done home health nursing, but sometimes the charting system can be a little dated. You know, it's not going to be like your Cerner. It's not going to be like your Epic. You know, it's not going to be all those systems that we're used to seeing in the hospital across the board at several different locations. Sometimes they'll have like little laptops for you to do your charting and things like that. They'll have some type of charting system for you. And sometimes, like in home health, I'm gonna tell you this, sometimes it's so dated, they don't even have a laptop. They do everything by paper still. So if you're okay with the possibility of having to kind of go backwards and paper chart, or having an electronic charting system that's still dated in comparison to Epic and Cerner, if you're flexible, let me just say that, then this might be for you. Last one I want to point out and just make you aware is that you're basically going to be on your own. Like I say, you're going to be working independently, but you want to think about it this way. There is no CNA, there is no charge nurse. So if you have questions and concerns, or sometimes you second guess yourself, or you want to just check with the charge nurse or one of your fellow co-workers or colleagues, you're not going to really have that unless you create a support system within the company, and depending on how supportive the company is. So if, let's say, the company is not supportive, then when you have those questions and concerns, there's nobody there for you to ask. Or let's say when it's time to turn your patient, because I'm gonna give you a perfect example. A lot of times when I used to work as a PD home health nurse, the kids were a lot bigger than me. The patients were a lot bigger than me at that time. And let's say I had to turn them or get them up for to bathe them or something like that. These kids were heavy. So a lot of times you're doing a lot of the heavy lifting without the assistance of a CNA, without the assistance of a fellow nurse there to help you do some of the things that you would typically do together in the hospital. It's all on you. And unless you have like a parent or family member that is very helpful and they're willing to help, which most cases they will help you, but not all the time, then that means you're going to be doing a lot of heavy lifting yourself. So that's just something you want to really think about. Like, do I want everything all on me, or do you just want to find an assignment that works best for you and something that you're most comfortable with? So those are all my pros and cons. I still love home health nursing. I don't know if I would do it again now in my career, but I felt like it was something really, really good to jumpstart my nursing career. And I would encourage anybody to get into it. And I feel like at the end of the day, if you need a job, home health nursing is always hiring. So if you guys have any questions, please comment below. Thank you so much for watching this video and supporting my channel. Please give it a like and subscribe if you haven't already. And I hope to see you in the next one. Bye, guys.